Have you ever been told by your doctor that you have a fibroid and the only options they gave to you were to either watch and wait or maybe surgery? Or maybe they said it's just because you're a woman, especially if you're a Black woman. If that's the only explanation you've been given, you're not alone, but you deserve to learn so much more. My name is Dr. Steffe, and I'm a naturopathic doctor. And every week, I help women with fibroids, hormonal imbalances, and painful cycles. And what I see again and again is that women aren't getting the full picture of what's happening in their bodies and in their health. So, in this video, I'm going to walk you through what fibroids are, why they happen, things to start asking your doctor about, and blood work you can do. By the end, you're going to have a clearer understanding of what fibroids are, and you're going to be able to start taking control back on your health. So let's start at the beginning. What are fibroids? Fibroids are non-cancerous tumors of the uterus. Our uterus as women it's a muscle. And when fibroids are growing, that muscle tissue can start getting super fibrous, like it gets very knotty and hard. Analogy I like giving patients that many people could probably relate to is the concept of a keloid. So, you know, where sometimes you can get a piercing and it might not heal well, or you have a scar that it gets all of this very tough tissue that forms and it's like a ball. It's a similar thing, but that's happening in our uterus. And I want you to learn that there are three different kinds and types of fibroids. This is going to be important because depending on the type of fibroid you have, it can sometimes dictate the symptoms that you're getting with your fibroid and or whether surgery can actually be possible or helpful. And so let's get into it. So this isn't getting too technical. This is where I like educating to help women understand some of the medical jargon. It doesn't mean that you're going to be a doctor or whatnot, but if you start learning the types, you're going to become more informed and educated on what's going on in your body. So there are the three types of fibroids. The first one is called a subserosal. So a subserosal fibroid. This is one that is on the outside. So if we were to have our uterus, so these are the ovaries, and let's say this is the uterus. This right here is the uterus. Forgive my drawing skills. A subserosal fibroid is on the outside. So this one is on the outside. That is important to remember because if it's on the outside, then this is where some women can have the feelings of pressure. They might actually be able to feel that fibroid. And these ones typically don't cause any type of heavy bleeding because it's on the outside. So it's like on the outside of the uterus. It can also be ones that could potentially, where doctors say, yeah, we will watch and wait because it's not causing any type of strong symptoms like heavy bleeding. And if it's on the outside of the uterus, then if the concern is for pregnancy and fertility, if it's on the outside and a baby grows on the inside, we might not be as concerned. So this one is the subserosal. Now let's talk about the second type. My whiteboard's a little small, so I can't put all of them together, but you get the drift. So the second type is called an intramural. An intramural. Hopefully that it can zoom in. I'm going to be putting the actual text on the screen so you can see it and start learning the terminology. Again, it's not to say that you're going to be a doctor, but if let's say you're given your lab or your report of your ultrasound, you can start understanding what this means if your doctor isn't communicating that with you. And the way that we would know the type of fibroid it is from an ultrasound scan. And so the second type is this intramural. And so aside, a lot of medicine uses Latin terminology, and different parts of Latin makes up the English language, but intra means inside. And so this type of fibroid is on the inside of the muscle. And mural is really, it's like intramural. Mural means muscle. And our uterus, even though we might not think of it this way, it is a muscle. And so this type of fibroid is in the middle of our uterus muscle. And so this one, because it's in the middle, it can operate similar to both an outside one and an inside one, but it's in the middle. And so for some women, they, depending on how big this one is, it can still create pressure. You might still be able to feel it because it's getting so big that it's extending beyond just the small area of our pelvis where our uterus is. And it can also potentially go the other way. So it might be growing on the inside of the uterus. The thing with an intramural one, it will depend on its location and size, whether sometimes a doctor or a surgeon would say to operate. But this one can still create feelings of pressure, bloating, and for some women, if it's starting to, because it's in the middle, and this is the thing where drawings like this can be helpful, but they're not in what's 3D space. Like we take up 3D space where we can't necessarily draw that or see that on an ultrasound. But if it's in a 3D space, if it's in the middle, that middle can be growing towards the inside and towards the outside. If it's growing towards the inside of the uterus, that can create heavy bleeding. And so this is going to lead me to the third type. What is the third type? And again, you're going to see all of this on the screen. But the third type is something called a submucosal. So a submucosal fibroid is one that's on the inside. So sub means in or underneath. Mucosal is the type of what's called tissue that's on the inside of our uterus. So really it's saying is this fibroid is on the inside, and it's on the inside where we have a certain type of tissue called mucosal. That part of stuff, yeah, you don't need to know all of that. It's like you're not a medical professional. But what this type of fibroid means is it is on the inside of your uterus. Because it's on the inside, in our uterus, we have something called our uterine, and I'll also put this on the screen, our uterine lining. That uterine lining is doing a couple things. That lining is what will slosh off every month, and that's what makes our periods. It's that lining that becomes our period blood. That lining is also where if we were to get pregnant, that is where a fertilized egg will implant and dig itself into to create a baby. And so if that uterine lining on the inside has a fibroid there, remember, a fibroid is a fibrous, stiff, and knotty tissue, something that's not supposed to be there. So if the fibroid is on the inside, these are the type of fibroids that can cause a lot of heavy bleeding because it's where that lining where it becomes our period. If there's something there, the body's going to say, hey, this is not supposed to be there. I'm going to create more inflammation, which I'm going to get to in a few moments. More inflammation means more blood, heavy bleeding. So this type of fibroid is classic for heavy bleeding. And this is also the type of fibroid where for some women, surgery can be very helpful, because it can interfere with the growth of a baby. Because remember, it's on the inside. So these are the three types of fibroids. You can start looking at your reports if your doctor hasn't communicated with this with you. And this is where, which we're going to get to in a few moments as well, is start asking these questions. And so even if you've been diagnosed with a fibroid before, now understanding and gaining this knowledge in your next follow-up appointment, you can start asking some of these questions. So you're going to learn more about your body and what's going on. And so by learning these three types of fibroids, you can start thinking and figuring out like, okay, like if I have heavy bleeding, do I have this submucosal type of fibroid? Will surgery be helpful for this potentially? So if you've been recently diagnosed with a fibroid and it kind of took you back, it could be because not every woman that has a fibroid has symptoms. And so now that you learn the different types of fibroids, it could potentially, the likelihood of a woman not having symptoms is she probably has a subserosal, like the outside type of fibroid, one that's outside of the uterus. It's kind of like, it's like just like, let's say this is your uterus. It's kind of like it's just stuck on there. And if it's not that big of size, then yeah, you might not have symptoms. And it could just be a finding where you're doing an ultrasound for something else, or maybe you are pregnant and they told you like, oh, you also have a fibroid. All of these things are possible, but then you could have symptoms. And so if, let's say, you're hearing about fibroids and you might not even know if you have one, these are some of the symptoms I would say to start paying attention to that can kind of influence you to go to your doctor to get it checked out through an ultrasound. And so things like heavy bleeding, the feeling of pressure or a bloating feeling that's not going away, challenges of getting pregnant, period pain. So because a fibroid is something that isn't supposed to be there. So it's like we weren't born with fibroids. It's not something, and I'm going to get into this in a few moments, but it's like a fibroid is a reactive reaction. It's not something that is just made up of a woman's natural biology. It's something in response to threats that your body is experiencing. So now let's get to the big question. We just learned what fibroids are, but why do they happen? Most people, including some doctors, think that fibroids are just something of the uterus. They grow in the uterus, but fibroids aren't just a uterus problem. Fibroids happen because of things that are going on in our whole body. There are three big root causes as to why fibroids happen, and I want you to learn what they are. So let's write them out. The root causes of fibroids. The first one is inflammation. The second is hormonal imbalances. And the third one, high stress. When we get fibroids, even though it's happening in our uterus and in that reproductive system, the reason why that is happening is because we have high inflammation, we have significant hormonal imbalances, and we have a lot of stress going on in our body. So let's break each of those three down. I'm going to be putting all of the names on the screen because I'm noticing that it's not in focus. So you won't be able to actually see what I'm putting down. And so let's get to the first root cause of fibroid creation. First thing is high inflammation. What does that mean? Inflammation is created by our body's immune system. And our immune system will only create inflammation when it feels the need to protect itself. And so anytime the body gets the signal that it needs to protect itself in any little way, not even it's things that we could be consciously aware of, but if the body, our subconscious body, automatic body, the body that helps our heart beat and helps us breathe without us having to think about it, if that subconscious part of the body feels threatened, it will create inflammation. And think of inflammation as these small little fires. Inflammation at the very root of it isn't necessarily bad. Our body designed inflammation to protect us. And so, if let's say we had a small fire, sometimes small fires are good. So, it's like if we had a little small campfire and it's small, it can help keep us warm, help us feel cozy, and in essence, help us feel good. And so, a small amount of inflammation isn't what's causing fibroids. But what happens is if this inflammation goes from a small campfire into a big raging fire, that becomes essentially a forest fire, one that we have difficulty controlling. And this is what happens with fibroids. Our body is experiencing a high amount of inflammation that's causing danger signals. When inflammation is creating these danger signals, it's going to send signals to the uterus, to our hormones, to not work the way it's supposed to work. So high inflammation turns on all of these different processes in our body that aren't supposed to happen. And that's where the signal can get confused, where the body naturally has a kind of like a stepwise system that goes through like security checks. Our body every day goes through security checks to say whether is this cell going to become a cancerous cell or is it not going to become a cancerous cell? If we have a lot of this raging fire of inflammation because our body is under threat and in protection mode, that security system checklist doesn't go the way it's supposed to. And the body, instead of saying like, hey, actually, no, we don't want this cancer cell, when we're inflamed, those cancer cells get turned on. The heat coming from the inflammation, in essence, is turning on those cancer cells. And that's creating the formation of that fibrous tissue in our uterus. The second thing that could be causing fibroids are hormonal imbalances. And so, as women, we have two major hormones. One is estrogen and one is progesterone. I like bringing back to women back to, okay, what are these hormones? What's their job? Kind of like, what's their job description? What are the things that they are designed and supposed to do? And if we look at estrogen tells the body to make certain things grow. And so think of back when we were children and then we biologically became young women. What created that? Puberty. What created puberty for us as young women? Our body turned on its estrogen. So estrogen wasn't really on, and then it got turned on. And so when estrogen turned on, what happened? We started growing breast tissue, and then we also started getting periods. Estrogen tells that lining, back to what I was saying before, that lining of the uterus, estrogen actually turned that lining of the uterus on, so it started to grow. When it grows and then goes through a cycle every month, it sloshes off and you get a period. So estrogen makes things grow. And if estrogen is getting turned on too much, it's like the dial got turned on like really, really high. It's like the volume dial. Like right now, estrogen in a healthy state, it's like at a comfortable level. Like we can hear the music. But when we have fibroids, that estrogen dial gets turned up so high, the music is blaring. Estrogen makes things grow. What are fibroids? They are overgrowths of non-cancerous stuff that grows in the uterus. It's an overgrowth. If we have too much estrogen, that could be turning on growth signals and things start growing the way they're not supposed to. And so we need estrogen as women, but when estrogen starts getting a little imbalanced, it could create the formation of fibroids. So we have to start understanding how estrogen works and how can we support it in a healthy way. Because the hormonal imbalances of having that excess dialed upness of estrogen, that is feeding the growth of fibroids for many women. And the third one, my favorite one to address because it gets the most overlooked. The third root cause of fibroid formation is having a high stress response. Now, I know you might be saying, but I'm not stressed. Dr. Steffe, like, I'm good in my life right now. How did I get a fibroid? There's a difference between what you perceive mentally as stress and what your body's subconscious mind perceives. If your body feels stress, and the stress can be a long workday, it could be not feeling emotionally supported within your family unit. It could be strained relationships with your spouse. It could be financial stressors. It could be the foods you're eating that your body's not liking and it's creating a danger stress response. All of these things add up over time. And if we have a high amount of stress and go in our bodies were not designed to operate like this. We can have stress sometimes. But what's happening in much of society is it's not sometimes we're stressed. We're stressed all of the time. Our body's constantly going and we're on. When our body's on, it's kind of like when you have your computer on and you have your browser open and you have 13 different tabs open. What happens? Things start overheating. Like the fan goes on your computer, especially if you have a laptop. I'm sure you've experienced this. You hear that fan going and your computer's starting to heat up. And then you're going to hear the music playing and you're not going to know where it's coming from. And then you're getting overwhelmed and feeling overworked because you're like, oh my gosh, what is happening? It's kind of like what's happening in your body when it has a lot of stress. It's like it's short circuiting. Even though you might still be able to show up day to day, do the thing, your body's feeling differently. And when your body is feeling those high moments of stress, it's going to turn on a danger signal. And so this is where these three root causes, they feed into each other. Because if your body's perceiving danger, if you remember what I shared in the root cause number 1, high inflammation, when does our body make high inflammation? When it feels the need to protect itself. When we're under stress, the body is in survival mode and it's trying to protect itself. So high stress is going to feed into the high inflammation. That high inflammation is going to feed into the high estrogen. All of these things are going to create the perfect environment for fibroids to grow. And this is why we can't just focus on the uterus. Think of all these different things. These 3 things alone. It's creating the whole body environment for our body to malfunction and not work the way it's supposed to. Okay, so now you learned 3 different types of fibroids and the symptoms that could be associated with them. You've now learned 3 reasons why they happen. And so now, what can you ask your doctor about at your next ultrasound appointment? Or maybe you're going for a checkup and you have a family history of fibroids, and maybe you do have some of the symptoms that I was talking about, and you're curious to learn, okay, I want to know more about my fibroids or if I have one. After this video, I really want you to feel confident and to have the information going into that next appointment. Instead of going in feeling confused, and leaving confused because you weren't given the right information. So here are some questions that I recommend women ask their doctors when getting checked to see if they have fibroids or having a screen. The first thing is, if you're suspecting you have a fibroid, asking for a transvaginal pelvic ultrasound. That's going to be the type of scan that's going to be able to, the imaging that's going to show us if there are fibroids in the middle of the uterus. And so you want to ask your doctor these questions. What type of fibroids do I have? How many do I have? How big are they? And what is the recommended next steps of action? How important would surgery be if needed? And then the last one is, there is no universal timeline of how often fibroids should get checked. Because it's something that I have a special focus in my practice, I recommend women get their fibroids checked through an ultrasound once a year. Getting it checked once a year is a long enough runway for us to see if any potential changes. And so doing it once a year, some might say, oh, that's excessive. In my opinion, I don't think so, because a lot in your body can change in 1 year. And this is where what I call preventative medicine comes in. If you're starting to get changes in your fibroid before symptoms start, then that can create room for a holistic root cause treatment plan versus a reactive one where your doctor tells you have a fibroid, you don't get it checked for the next 5 to 6 years, come to learn that 5 centimeter fibroid is now a 10 centimeter fibroid, when 5 years ago, if you knew that, you could have intervened and been monitoring it on a year-to-year basis. The other thing that I also want you to learn is, if you notice major shifts in your period that are out of the normal and that happen over a couple of cycles. So I'll give an example. Let's say, over the last 3 to 6 cycles, you're noticing that your periods have become a lot heavier. If you're noticing heavier bleeding, more pain, more feeling of pressure or bloating, if you're starting to notice those changes and they didn't happen before, or if they were happening and they got worse, this is when you're going to want to get an ultrasound to get assessed to see if there are fibroids, or if you do have a fibroid, to see if that could be a potential cause as to why these changes are coming about. Now, the last thing that I want women to know about is blood work, labs. Some people don't do this, or doctors don't do this, because they think, oh, fibroids, uterus problem, we're only going to do an ultrasound imaging. But there's a lot of research that can support a couple of things. The one biggest thing is that women that have fibroids are more likely to be low in the vitamin D. And so if we learn that we have fibroids, it is important and paramount to be checking your vitamin D regularly, because we want to make sure that you're in a healthy, optimal range. When we dip too low in our vitamin D, the risk of our fibroid growing and or new ones coming up gets higher and stronger. And this can also help dictate what type of dosing we need for our vitamin D. We have to do blood work versus just blindly, seeing like, oh, okay, I'm seeing that we need to take vitamin D. You need to do it in accordance to blood work and with an experienced practitioner. The other very important thing is your iron status. For a lot of women, even if they don't have fibroids, can be very low in iron. It's because we bleed every month. And so if we don't know how our iron's doing, if we do, let's say, have heavy bleeding from having that inside uterus type fibroid, and we're constantly bleeding, we want to make sure that our body is getting replenished and nourished with its iron. And so we want to also track our iron constantly to see if it needs support. Okay, so let's do a recap. Fibroids are non-cancerous growths of the uterus. They aren't things that just happen. And the three major root causes of getting fibroids are having high inflammation, having hormonal imbalances, and having high amounts of stress. You want to be able to ask the right questions to your doctor so that you get all the information you can once you learn about your fibroid diagnosis or when you're having a routine check. And the last one is we still want to run blood work when we learn or have fibroids, especially checking our vitamin D and our iron. In the next video, I'm going to talk more about the natural supportive options you have for your fibroids. So things like the foods you're eating, your lifestyle, the stress management, all of these things matter and can make a huge difference in how you experience your fibroids and symptoms. So make sure you hit subscribe. And if you want to learn a little deeper about these root causes and what you can do in terms of your fibroid management, hit the link in my bio. I have my fibroid guide for you to download.